Hello everyone, my name is Nada Hagani. Today we talk about statistical versus clinical significance. My partner Pendor Haide and I contributed equally to this project. We hope that you enjoy this. Utilization of evidence-based practice is crucial in clinical decision-making and requires generating new knowledge and validation of treatments. There are various methodologies for researchers to report the study results while evaluating their significance. Let's talk about two major methods. Number one, statistical significance is a mathematical or quantitative method that can help us examine the study's reliability and help us to quantify if some of the actual results happened randomly. This method examines null hypothesis versus alternative hypothesis and accept or reject the null hypothesis based on the value or probability level. The null hypothesis is the exact opposite of what an examiner predicts. For example, our hypothesis says a sedentary lifestyle increases morbidity in COPD patients versus a null hypothesis. Most often, p-values less than 5 or 1% indicate strong evidence against the null hypothesis. The second method, which is clinical significance, is based on the researcher's interpretation and indicates whether the study results are meaningful, practical, or simply refers to the impact of the treatment. In research, statistical significance can help us hold confidence that our findings are reliable, genuine, and not due to chance when utilizing p-values and confidence intervals. Therefore, we can decide how much risk we're willing to take with all available resources. In addition, statistical significance can't guarantee if findings are relevant or practical in clinical settings, since factors such as population size and degree of randomization produce different results. On the other hand, the essential question of clinical significance is if a treatment is effective and how it impacts clinical practice. Clinical significance indicates whether the study results are clinically relevant, practical, and meaningful, while considering various factors such as associated cost, harms, or any inconvenience. Clinical significance relies mainly on subjective interpretation of research findings.
Present an example using reference to literature of each. Statistical significance. An example is a new blood pressure medication created to lower diastolic blood pressure. The name of the medication, in this case, is diastolic H. It was created to lower diastolic blood pressure by at least 15 mmHg. The hypothesis of this case will be taking the diastolic H medication will lower the diastolic blood pressure by at least 15 mmHg compared to not taking the medication. The next step will be to establish the null hypothesis. In this case, the null hypothesis will be taking the diastolic H medication would not lower the diastolic blood pressure by at least 15 mmHg compared to not taking the medication. In this study, the alpha, which is the significance, which is the level the researcher is willing to be wrong, is 0.10. 0.10 is equivalent to 10%. So the researcher is willing to be wrong 10% and right 90%. In this case, half the patient received the diastolic H medication and the other half will provide no medication. The diastolic blood pressure of the patient who received the diastolic H medication decreased by 3 mmHg, which is equivalent to a p-value of 0.03, which is 3%. We can interpret this research result to have a statistical significance because the p-value of 0.03 is less than the alpha value of 0.10. These findings reject the proposed hypothesis because it is less than 0.10. If the p-value were more significant than 0.10, then the hypothesis would be accepted. Clinical significance. The level of clinical significance focuses on the results being more beneficial to the patient than the clinician. In this example, the clinical significance will be 3 mmHg drop in diastolic blood pressure after taking the diastolic H medication. Both clinician and patient will benefit more from the clinical significance of this study, although in this case, the diastolic pressure only dropped by 3 mmHg. Explain how you will utilize these differences as you review literature. It will be best to understand both the statistical and clinical significances of the study. Knowing the clinical value will create a more clinically applicable approach. It is essential to understand how patients are affected clinically by these studies. I will continue to evaluate both significances during my literature reviews, but I will focus more on the clinical importance because it has a greater impact on the patients. All clinicians should understand both statistical and clinical significances and how to apply hypotheses while creating a null hypothesis, ultimately to have a greater impact and provide optimum care to the patient.